Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a PT assistant. Today, I'm interviewing Mary Ann, who is a retired nurse and an old colleague of Bob's. She was experiencing some knee pain even years after she had both of her knees replaced. Bob recommended she tried the Fixing You method for knee pain by Rick Olderman. It can be found on his website, and she found to have some great success with it. So we thought we would interview her and get her point of view on the program. So without further ado, here's Mary Ann. Well, welcome, Mary Ann, to the program. Thank you for joining us today.
Sure.
Can you describe your initial pain and what you were doing to combat it?
Okay. First, for just a little bit of background, I'm 70 and I have some chronic joint issues. I've had both my knees replaced and I had a severe ankle injury about 5 years ago. So my baseline had some chronic issues to deal with. But every once in a while, I would have what I call a flare. And I would have severe joint pain, especially my knees, and that would affect my quality of life and my day-to-day functioning. For instance, the hot tub really relieves my chronic pain. I always feel about 10 years younger when I get out of there. And when I was trying to get into the tub, lifting my leg across, I probably had a level 8 pain getting in there. But I got so much relief from it, I just kind of pushed through. The other issues I was having was I was unable to sleep. I couldn't find a comfortable position. I'm usually a side sleeper. But I could only sleep on my back. And then I actually found I was sleeping in the recliner because it kept me in more of a one position. As far as trying to treat it, you usually try to treat it yourself. I tried a lot of over-the-counter types of things. I tried every topical you could possibly think of. The hot tub did help some. I alternated hot and cold, and I just wasn't getting any relief. So I did go to my nurse practitioner. She started me on Celebrex, and then some Cymbalta, which is supposed to help chronic pain. I didn't like just taking medication and not finding the cause. So I did contact Bob, who's an old colleague of mine in years past, and he recommended Rick's program. And I did sign up for the online program and started that right away. One of the biggest things I found that helped me in that was looking at your habits. Because obviously something I was doing was triggering these flares that I was having. And I found that my posture was horrible, and found that I needed to be wearing shoes with good support was another issue. And then I was locking my knees, which I found was a big no-no also. So Rick's program, the exercises helped. Another big issue I'd been having was balance, and he has balance ones also. So that's kind of where I started out.
Did you have any relief like after your knee replacements for a while or no?
Oh, definitely. I had those maybe 10, 11 years ago, and I had both knees done. And normally it isn't an issue. On my day-to-day, normally I don't take anything I don't even take Tylenol for pain. So these flares are a real abnormality for me, and when they get really bad like that.
They really flare up.
Yeah.
And don't feel bad about the locked knees. I do that too.
Oh,
It's pretty common.
I have been practicing so much that it's now become habit that I don't. So that's really helped a lot. I also did go and have my knees x-ray just to make sure it wasn't something with a knee replacement, and they were fine.
Good.
Did rule out that.
So, what percentage are you better from using the program, would you say?
Um, it's hard to do that. As far as I'm definitely back to my baseline, and I'm actually better than my baseline of how I usually am. So um, I guess if you look at it that way, I'm probably 100% better.
How fast did you get relief from doing what he recommended?
In following the tapes and that, I moved at a much slower pace, but obviously with my age and my chronic issues. Um, but as far as if I use getting into the hot tub as one thing to look at, within I bet you 4 days I could get into the hot tub without that. My pain level went from about an 8 down to maybe a 3 within days. I was shocked actually.
Yeah, it's
Um,
pretty quick moving.
yeah, I obviously some of the other things took longer than that, but if I use that as an indicator that it really did help quicker than I expected it to. Mhm.
What are 2 or 3 of the exercises you found the most helpful?
There's a massage exercise behind the knee that I felt really helped, and I used manual massage, and I also used one of Bob and Brad's massage guns to do that, and then the balance exercises I really liked because that's been an issue. I was unable to stand on one leg for
No. Well, yeah, that's gets harder as you age.
yeah, even a couple seconds. And then when you have the knee surgery and the ankle, I've got all kinds of rods and pins in my ankle. So I was unable to balance on one leg for more than a second or two, and now I can. I've made a lot of progress in that area too. So that's been one of my a big area that was a bonus, I guess you'd call it.
Yeah. Is that later in his, online program? The balance stuff?
No, it's one of the initial exercises where you stand on one leg. And then I also used one of it was from another Bob and Brad video where Bob said that when he ran, he would go sideways. And my husband makes fun of me because I walk around the house walking sideways all the time. So I think that one's helped also.
Oh, yeah, your if your hip abductors are weak, it can
Yep.
affect
Yep.
that. Yeah. So, do you have any advice for someone else who is experiencing knee pain?
I think rather than just trying to medicate yourself or find a topical that's going to dull it, you kind of have to get to the base of finding out why it's happening. Um, Again, Rick has a really good video talking about that, where he talks about your habits that you're doing that can cause some of those things. And I did find some bad habits. Um, and so I'm looking at it, preventing this from happening again the next time. And he also, his exercises have, I can't get down on my knees because of my knee replacement. So many of the exercises I couldn't do, but he also always gives alternatives if you can't do something. So that helped. And another really good suggestion he had that I wish I had thought of earlier was trying to get down on the floor and up has always been an issue for me. And if you go sit on the edge of a stairway, walk down a couple steps and then sit on the top, and then you can lay back from there. And again, same way to get up was huge for me. And again, I wish I'd thought of it years ago.
Yeah, that's a good idea. So that's just for people that have trouble getting off the floor?
Right. Yeah. Or getting down onto the floor to do an exercise. Yep.
Sure. So you just do your exercises on the stairs, or do you just use it to
No, that
practice?
no, that gets me up and down.
Okay.
I actually kind of worked my exercise into my day. I found I was better at doing them. There's some of the stretches I do when I'm in the hot tub. I do uh, toe lifts when I'm brushing my teeth. I kind of throughout the day have times where If I'm sitting, I'll do a sit and stand, sit and stand. I kind of work it throughout the day rather than doing a lot of exercise all at once. For me, it just is more natural, and I'm more apt to do them.
Right. Most people find that. I mean, Bob and Brad even recommend that it's better to do like 10 1-minute exercises throughout the day versus one time doing 10 minutes straight.
Right. Yep.
It's just more beneficial to get more movement, and it gets things limbered up continuously throughout the day.
Right.
Is there anything else you would like to add about the program or any other benefits?
Just that again, it really helped me. I'm not on any medication again. I'm not doing any topicals. I'm not even taking Tylenol right now. So, and prefer to not be on those medications if I don't have to.
All right. You're a good patient then.
Yeah.
All right. Well, thank you for joining us today.
Okay. Thanks, Mike.